Hello, welcome back. The topic today is about robotic surgery. What is robotic surgery or robotic assisted surgeries? So nowadays the trend is every surgeons started calling themselves a robotic surgeon, and people also start asking about a robotic surgery. So what is that? So most of the people think your robo is doing the surgery or your robo autonomously doing the surgery. Definitely not. So robotic surgery is nothing but a way of a mode of surgery, like where a surgeon is operating. So here also the surgeon is the one who is operating. So those days it's like a open surgery. So they cut open, they see the surgeon with a naked eye they will be doing the surgery. Then came the laparoscopic surgery, the minimally invasive endoscopic surgeries, where so the camera has been put inside the body, so the images are collected and seen in the monitor. So the surgeon will be operating looking at the monitor. The monitor is a regular television, 2D, a television, two-dimensional television. So the same thing is the robotic surgery, but where instead of standing near the patient, the surgeon will be sitting little away from the patient. Like there is a console, the table, operating table will be there, the robotic arms will be near the patient, the surgeon will be sitting little away in a console looking at the monitor. The monitor is a 3D, the three-dimensional monitor. So that is the main thing, and you'll be sitting and relaxed. You can do the surgery. So what are the advantages? So first is the advantages to the surgeon. So it's like first is, as I said, it's a 3D image. So the depth of the tissue can be easily seen. So the dissection will be more precise. No unwanted dissection or no damages, unwanted damage to the tissue. That is the first thing. Second is tremor filtration, where even if some surgeon, old surgeons, they have a tremor or for some shaky movements, nothing will happen there. So like whatever happens, even a very worst movement, there the robo will not do all those things, unless otherwise a precise dissection will be there. The and the blood loss will be very less compared to the, because 3D vision, very close vision, so the blood vessels will be obviously seen to the surgeon, so he will not unwant, unnecessarily they may not cut the blood vessels. And very importantly, the suturing, though the field will be limited compared to the laparoscopy, but the suturing is extremely easy. Even a complicated maneuver in the suturing, or in a complicated site where the suture has to be done, can be done very easily with the robotic surgery. So what are the advantages to the patient? So first, as I said, so there may not be not much of advantage compared to the laparoscopy, but still there is a much advantage is there. Like, since the surgery is more precise, so the tissue healing is fast, so the recovery is fast, and the blood loss compared to the laparoscopy definitely minimal. So again, recovery, the nutrition status are all well preserved, and uh, surgery is done in a closed manner, where with the robotic, the suturing is very easy for the surgeon. So resection, anastomosis and all more precise, so chances of leak and iatrogenic damages are very less with the robo. What are the disadvantages? There are not much disadvantage. If at all, we can say the duration of surgery may be little longer, and people think even today the it's a very costly procedure, or it's only for the rich people. No, anyone can. The only disadvantage, it's little costly nowadays. It's almost 1.5 to 4 lakhs higher than the regular laparoscopic surgery. But as more and more companies are coming with newer models and newer versions of compute robots, definitely down the lane another 4 to 5 years the cost will come down drastically, and it will be a standard procedure, like like laparoscopy is now a basic minimum standard procedure for any surgery. The same way laparoscopes, I mean, the robots will become a standard procedure. And the myths about the robotic surgery, people think a robo is doing the surgery autonomously. No, even today, the surgeon is the one who's doing, but the only thing is he'll be sitting and doing the surgery more relaxed. And there are telerobotic surgeries are even now has come. Like I mean, suppose I'm sitting in Chennai, I can operate as a patient in Calcutta or Delhi, where the console is there, the robotic arms will be there in a different OT. They can do the surgery, but again there will be a surgeons here, and near the patient the surgeons will be there. And people think the risk, it's a very risky surgery. No, like any other surgery, risks are the same. Even in, if suppose something goes wrong, it can be easily converted to a laparoscope or even a open converted surgery. So robotic surgery is going to be the future. And even the autonomous robots, probably it may even come, but it may take years. But now the future is robotic surgery. Thank you.